Hi there, this is Rochelle Morgan from Show Me Hope and Tri-County Mental Health Services. Show Me Hope is our state's crisis counseling program, which is funded by FEMA and SAMHSA after a federally declared disaster, in this case, the COVID-19 pandemic. I'm here to give you, as an organization leader, an overview of how we at Show Me Hope can help your organization and the individuals within it to cope with the disaster that is COVID-19. So we are here to help organizations and individuals build resilience. Resilience is defined by the American Psychological Association as the process of adapting well in the face of significant sources of stress. We have a picture of resilience right here with these dandelions poking their way out between the asphalt and the concrete, right? So despite the hardship, these flowers are finding a way to bloom. That's what we want for the people that we're supporting through Show Me Hope. Now, we know that most people are resilient in the face of disaster. With a little bit of help, people and organizations can recover faster and be stronger into the future. Now, people are impacted differently by the COVID-19 pandemic. Of course, some of us are experiencing illness, hospitalization, and even the death of loved ones. And that is the deepest impact that this coronavirus is having on people in our communities. And that may be true for you or for the people in your organization. But we also are impacted on different levels as well. Some people have been affected by unemployment, furlough, decreased revenue. Even more of us have been affected by school changes, physical distancing, missed rituals like weddings and graduation and funerals and the holidays. And then every single one of us is living in this world where the stress of the pandemic, the fear of the unknown is just in the air. And it's in our national political conversation, it's on the news, it's in having to put on a mask when you go to the grocery store or the post office. Everyone is affected, although we're all affected in different ways. The good thing is that every individual can be resilient in the face of this pandemic as well. Now, organizations are also affected by the pandemic. First of all, organizations are made up of individuals. So when those individuals are stressed, the organization is stressed. But also, a lot of organizational resources and systems are being strained during this time as well. For one, a lot of us are doing a lot more cleaning. That takes a lot of time and staff effort. Also, a lot of organizations have experienced a drop in revenue because of the pandemic and the economic distress. And of course, that is impacting organizational resilience as well. So how can an organization build resilience? How can we be strong in the face of a disaster? Well, I'm going to break it down into the 3 steps. Understanding the different circumstances that we're dealing with, making support available for individuals, and building a culture of resilience. Step 1 is to understand the different circumstances. I have a picture here of the disaster recovery roller coaster. This is what we experience when we're recovering from any disaster. This image comes from SAMHSA to explain the emotional highs and lows that we often go through. Now, we did have this initial impact of closures and first starting to see people be impacted by the virus. We had a honeymoon phase when we were all pulling together to find solutions, to take care of our kids and families, to sew 100,000 cloth masks for the healthcare organizations and things like that. But we are now in the period of disillusionment when we're realizing that it's going to take a very long time to recover, that there are lots of problems that we're going to be facing, and we're having these highs and lows as we move through time. The realization that this is going to take a very long time to recover from is difficult to face. And this disillusionment phase is going to be a very difficult time for our organizations and for the people that work there. So one way that Show Me Hope can help is by providing education around the pandemic, around the way that we recover from disasters. There are lots of different topics that we can cover for you, and we can do that in educational materials, presentations, and also through individual or group crisis counseling or support groups. So If you feel like you need to understand better what is going on from a mental health perspective or from a resilience perspective in your organization, we would be happy to talk with you about that. After you understand the different circumstances of the pandemic, then step 2 is to make support available to individuals. Now, there are different things that you can do as a leader to support individuals, and I have those listed here on the screen. But you can also get help from Show Me Hope with crisis counseling for individuals or for groups. We can set up a support group for people within your organization. Now, when individuals are getting support that they need, your organization support needs some support as well. And we do that by building a culture of resilience. You do that by promoting self-care of all kinds, setting boundaries around work hours, creating flexibility for individuals, modeling self-care, and creating opportunities for self-care among the team. We can go into more detail on that in some educational materials or presentations for your team. And we can also help by providing resources and doing support groups or individual counseling as well. So for your organization, the next step is to access some of those resources that we have for you and to start understanding the disaster. We have a lot on YouTube. Our YouTube channel is bit.ly/showmehopevideos. And we have a lot of material on there on coping skills, self-care, understanding the disaster that can help to give you a picture of what it means to be building resilience during this time. Now, for individuals, they can call or text the disaster distress hotline. That's available 24/7. We have translator services available. It's free and anonymous. No insurance. No, we don't open a chart. We don't even ask for the person's address and phone number unless there's going to be a follow-up session. So the National Disaster Distress Hotline is 800-985-5990. And that number is good anywhere in the country. It'll filter people down to someone in their local area. Now, for your organization, if you want to look into having group counseling, support groups, if you want to have an educational presentation, or if you simply want us to send over some materials that you can post in your break room or send out through email to help people cope with this disaster, you can contact us at Tri-County Mental Health Services. Our phone number is 816-468-0400. You can also email your community contact at Tri-County. That might be me, Rochelle Morgan. It might be somebody else on our team. Reach out to them and we'll make sure you get to the right person to get you set up with resources. All right, so we have lots of resources. We have lots of people who are here to help you, your employees, your organization, your volunteers, everyone to be resilient in the face of this pandemic. So reach out. We're here to help. We're here to show you hope. How about that? I will see you again soon.